My name is Dr. Henry Galuba Jr. I'll be discussing hypothyroidism and hyperthyroidism. Okay, so hyperthyroidism is the opposite of hypothyroidism. So in here, from the prefix hyper, it means that the thyroid gland is overacting or overfunctioning. So once it does, it produces more than the hormones that we need. So also the signs and symptoms would be opposite hypothyroidism. So in here, we can see weight loss, we can see palpitation, we can see tremors, we can see diarrhea, we can also see menstrual changes, and sometimes even insomnia. Okay, the causes of hyperthyroidism, just like hypothyroidism, is primarily genetic. We have an autoimmune disorder, which we call Graves' disease. Majority of hyperthyroidism is because of this etiology. Then we have thyroiditis. Thyroiditis is inflammation of the thyroid. And again, this is a type of autoimmune disorder. And then thirdly, we have thyroid nodules. Thyroid nodules are lumps of cells which grows inside the thyroid itself, and they have the ability to produce thyroid hormones. So those are the most common causes. Yes, it's similar because there's no ethnicity preponderance. It can happen in all ages, and it can happen in both genders. But this is more common in women, just like hypothyroidism. Yes, primarily, as I mentioned, one of the signs and symptoms is menstrual problems. Okay, some of the menstrual period of women get delayed. Okay, so once this menstrual period is delayed, or sometimes it's prolonged and heavy menstruation, this can affect the fertility, primarily because it affects ovulation. The diagnosis of hyperthyroidism is similar to hypothyroidism in a way that a blood test is needed, which is the TSH test, or the thyroid stimulating hormone test. As I mentioned, this is inversely proportional to the activity of the thyroid. Therefore, we expect the TSH to be low in hyperthyroidism. Now, aside from that, there are other modalities like the radial iodine uptake. We also have the thyroid scan and the thyroid ultrasound, which determines the presence of nodules or if the thyroid is enlarged. The treatment of hyperthyroidism, it is the opposite of hypothyroid because, as I mentioned, that there is excessive amount of thyroid hormones in the body. So what you give is anti-thyroid medication. Now, it can be in two forms. We have the methimazole or the PTU. Okay. One special note here is that pregnant women should be aware that they're having a thyroid problem, because the medication to be used depends on the trimester that they are in. So it's always important that they tell the OB/GYN doctors about this. The next treatment modality is beta blockers. They call it beta blockers. Okay, it's a drug which minimizes the signs and symptoms of thyroid. It does not directly affect the thyroid, but it cures the presenting symptoms like palpitation, you have tremors, agitation. Okay, this is controlled by blockers. Then we have what we call a radioiodine therapy, and this is again a type of medication or a dye which can reduce the activity of the thyroid. Then last, we have surgery, or what we call thyroidectomy. Okay, this is the removal of the thyroid itself. So the only setback here is once you remove the thyroid, you will have the preponderance to have hypothyroidism. So on the long run, you also need medications for hypothyroidism. Well, again, with regards to hyper, it's the same. It is non-preventable like hypothyroidism because majority of its cause is genetic. So it's autoimmune. Therefore, again, early screening or early determination of the signs and symptoms is very important. So you can consult your doctor for the proper diagnosis and intervention.